A trip to the hospital is not always straightforward. Some visits are over in a couple of hours, while others may keep you in bed for days. There are three main different types of hospital visits, and today I'll go through them with you. Two of them are quite easy to understand, so let me start there. The first is the one you already know. You come in, the doctor sees you, and you are home the same day with no bed and no overnight stay. This first type covers the everyday things: a checkup, a blood test, a scan, or a small treatment like an injection or a couple of stitches for a cut. The medical term for this is outpatient care, or OPD. The second is when going home the same day is not an option. This is when the hospital admits you and you stay for one night or several. You are looked after in a ward by a nursing team around the clock. It is usually for major surgery, a serious illness, or anything that needs constant monitoring. In medicine, this is called inpatient care, or IPD. The third type sits between the two, and it is the one people mix up. It is called a day case. You are still admitted to the hospital and taken to a bed for your treatment or small operation. But once the doctor is satisfied that you are medically stable, you can go home the same day with no overnight stay. Now, here is where people can get confused. You would think the more serious the medical condition, the bigger the visit, but you often cannot tell the type of hospital visit from the diagnosis alone. Let me give you three quick scenarios. First, let's take cancer as an example. The first thing that might come to mind is a patient spending weeks in a hospital bed, right? In fact, many cancer treatments, such as chemotherapy and targeted therapy, can be done as outpatient visits. The patient comes in for the session, goes home the same day, and comes back for the next one. Now think about a serious accident, such as a broken leg, which will require surgery, and recovery may take a few days in the hospital. On the other hand, a minor accident, like a sprained ankle or a small cut, can be sorted in a quick outpatient visit. My last example would be the flu. Most of the time, a patient can be treated in the outpatient department, get prescribed some medication, and go home to rest. However, the flu is a condition that can quickly turn serious and lead to a chest infection. For someone who has other underlying medical conditions, the flu can turn into an inpatient stay. So as you can see, the diagnosis on its own does not determine the type of hospital visit. It comes down to how severe the case is, along with other factors that can raise the risk. So why does all this matter to you? Because the cost of the different types of visits can vary a lot. Inpatient care is the most expensive by far. Once you combine the fee of the bed, the room, the nurses overnight, and the monitoring, the total can climb fast. Outpatient care is the lightest on your wallet, and a day case sits somewhere in between. Think back to that flu. Treated as an outpatient visit and sent home, it usually doesn't cost that much. It's manageable. But if it turns serious and you are admitted for a few nights, the bill can be many times bigger. So the same condition can lead to very different types of visit. And it is the type of visit, not the name of the condition, that decides what you pay. It is also worth understanding what actually decides this, because it is not personal preference. The decision rests on medical necessity, meaning what your condition genuinely requires, guided by internationally recognized medical guidelines. That is why the same case should point to the same answer, whoever is treating you and wherever you are. So here's a quick recap. Outpatient means you are treated and sent home the same day. A day case means you are admitted for a procedure but can still go home that same day. Inpatient means you are admitted and stay the night. And because the same condition can move between all three, one person's quick visit can be another person's overnight stay. If you are looking at health cover, a couple of things are worth knowing. A plan built mainly around inpatient care is often the cheaper option because although a hospital stay is expensive, people rarely need one. Outpatient care, on the other hand, is used far more frequently, so adding that cover can cost more. But read the details, because some inpatient-only plans do have extended coverage, which can cover some specific outpatient care, such as cancer treatments or day case surgeries. So check what the plan actually covers, not just what it is called, before you choose. And if all of this feels overwhelming when it is actually happening to you or to someone you love, that is completely normal. Just ask the hospital which type of visit you are being treated as. It is a simple question, and the answer tells you what to expect, from how long you might be there to what it is likely to cost.